Hello, everyone. It's Dr. Vladimir Barriev here, general pediatrician specializing in autism for children. And we are here on our channel, Autism Demystified, with a very special treat. My good friend, Dr. Jill Kissel. She is joining us and to discuss physical therapy and physical development in children. So I'll give you a little brief bio about her, just to see how wonderful she is and has been for the community. So Dr. Jill Kissel is a pediatric physical therapy outpatient practice owner with 3 offices that she has opened since 2010 and 21 years of clinical experience in this field. She has worked with children from birth to 18 years of age. Her passion is working with children on an individualized basis to help them achieve their most optimal level of independent function. She has obtained her clinical specialty in pediatrics and continues to encourage her staff to increase their education and skill sets by providing continuous educational opportunities. Also, I am lucky to call my friend because she has truly a heart of gold. When you meet people who truly care about children and are exceptional in their field, their radiance shines through, and this describes Jill perfectly. So, welcome. How are you doing today?
Great. Thanks for having me. I really appreciate this opportunity and having a nice, wonderful discussion with a colleague and friend.
It is truly my pleasure to have you here and to share your wisdom and experience with our community. So, a lot of families do come to my office and we have conversations about their child's physical development all the time. So, I wanted to share with you some of the questions that I often hear, and so we can discuss for them for any families who may have questions on their mind. So, when a family is referred to a physical therapist, what does an evaluation with a physical therapist look like?
So when you come in for a physical therapy evaluation, we've already contacted you to make sure that the child's wearing the appropriate clothing, that you have the correct, any kind of medical records that we might need so that we can have the discussion. So you come in with all that information and the therapist greets you, has her documentation ready and or his documentation ready, and they get a really great background, right? Because your child might come in a little bit older, or they might come in as an infant, but sometimes there's a piece of the puzzle that we need from in utero or soon after birth. That's very important. Some kids come in with a long, extensive medical history, and some might have a little clue in there that they don't realize is so important. So we get a really, really great subjective component to our evaluation. We take a lot of time. We're very thorough with that. We then move into an objective section where we're doing our measurements. We're checking whatever the case may be, if it's a body part or a gross developmental delay or a neurological condition. We're measuring and taking numbers on things where we would like to either see the improvement, have a baseline number so we can make sure that we're not only documenting, but making enough progress for the family to see where the child has been moving along with our treatment. Then at the end, we like to talk about our plan. We like to talk about what the goals are. Our goals might be very different than a parent's goals. So it's extremely important to involve the parent in all aspects of the eval, but especially in the goal section and the planning section. So, involving the parent in the eval is potentially even more important than the child, just to make sure that we have the right information, we're conducting the right tests and measures, and that we're making the right plan that works for the family, with guided clinical expert advice on where we think this child should be when they achieve their full potential.
So thank you for that. Families would come into your office, and should they expect to see? Would the child be taken away to be evaluated away from the parent? Would it be a parent and child together? Would it look like uncomfortable for the child? Would it look like they're playing with the therapist? Could you break that down for us?
Sure. So when we're doing the interview, typically the child is playing with the toy. We like to secretly observe what they're doing naturally in their environment. We might note that to the parent while something's going on. Oh, I noticed that they're doing A, B, or C. But they're always playing. The idea is to also make them comfortable. Even though the gym tends to be a really fun environment, They come in, they know it's either Dr. Jill, for instance, they hear doctor. We want them to know that, yes, it's going to be work, but it's going to be fun too. So that this way it calms them down, gives them a sense of normalcy in a very vibrant environment, and that they get comfortable. So they get comfortable while we're talking to the parent. They can sense that the comfort level too with our discussion with the parent. Then during the objective measures, we really try to then truly just focus on what the child is doing and what we need to measure, and discussing at the same time with the parents what we're finding. That way, in the back of their head, they can kind of maybe adjust their goals if they didn't notice something, or think of that part of the aspect of why they came in. And then in the goals section again, typically we'll let the child play. We've, at that point, 45 minutes in, we figured out stuff that they really liked. So we might bring out the same toys or involve them in the same activity, that we can again focus with the parent a little bit more on where we need to be, where they think they could be, and how we can help.
Fantastic. I just wanted to add a point here. When you mentioned vibrant gym environments, I have visited all of your centers, even the one in New Jersey and Staten Island. And Leaps and Bounds is the name of her wonderful physical therapy centers for children. And beautiful, clean, organized. It's a place where kids come and they are ready to rock and roll. There's so many fun activities for them to do that it makes it feel like they're not really working. So just wanted to paint that picture for everyone out there. This is how vibrant and wonderful these are. I'm ready for my next question to give you. Question for that the parents have is, how difficult is it to find a physical delay when a parent is observing their child? Like, is this something that parents are going to be the first ones to notice their child, or other caregivers or pediatricians will bring it up to parents? What do you find in your experience?
So in my experience, there's a variety of ways actually. So sometimes from birth, if there's a genetic disorder or a neurological disorder, the parent might know from birth to expect some delays. Honestly, the frequency of their pediatrician visits in the beginning, likely they're making sure their reflexes are intact, that their motor skills are intact, lots of other assessments that wonderful pediatricians like you do, and then they might be referred. Or a lot of parents come in, honestly, and you hate to play the compare game, but they might say, I was chatting with my friends, they're all around the same age, he's not or she's not doing the same things, I'm just a little concerned. Or family that has had children. So sometimes it's from gentle nudging from family members or friends, and sometimes they're ahead of the game and they're having an expectation of a delay. And either way is fine, because they're noticing it and they're reaching out for help. I think that's the most important part, is that they're acknowledging it and getting the help.
Absolutely. Um, Can you just answer a question for families? What do we mean when we tell families word pediatric milestones? Like, what do we mean by milestones? And when should parents be concerned for delays in those milestones?
Okay, so milestones are general ages. I'll speak for physical therapy because there's other milestones in social domains and cognitive, speech and OT. But for physical therapy, there's certain ages we expect certain skills to be achieved, such as sitting, crawling, creeping, pull to stand, walking. Um, and we use those milestones as a judgment of, okay, this is something major they should be doing. If they're behind in that, maybe we should really look into their development as a whole. It could almost be a trigger to it. So the milestones are really not just the only thing we're looking at. It's almost a signal, as something to say, maybe we should really take a better look at this child and see, is it just that motor skill? Is it a more global issue? Are there other domains that they're losing out on right now or haven't caught up on? It's almost like a red flag to me. It's not just, so if a child just comes in, oh, they're not walking, I'm not just looking at walking, I'm looking at what they've achieved, where they're at, in comparison to a norm for that age, and maybe other alignment issues and whole body assessment. And honestly, doing this for so many years, to also pay attention to the other domains. So I'll notice if, you know, their fine motor is a little delayed, or speech or cognitive, and we can make the appropriate referrals, because that's not in our wheelhouse, and we would have to refer out or call the pediatrician and recommend. Um, in terms of being concerned about a delay and when they should, what I love is when you go to a pediatrician, typically there's a checklist, and or they'll say, is your child doing A, B, C, or D? Um, and I think that kind of keeps the parent and the pediatrician aware of what's not being achieved at the moment, that maybe in the moment is not necessarily a major concern, but that they can kind of keep an eye on it, and then they'll ask again. So in the beginning, when a child is very young, you're going more frequently to the pediatrician, and these things are typically caught pretty early now. But as a child gets older, you'll start to see the quality issues kick in, where they're walking, they're running, but you might find they're clumsy, or you might find they're not coordinated. So, the red flags to me for an assessment, that where maybe the child is kind of achieving their milestones on time, because that itself would be a red flag, would be uh, lack of coordination, falling a lot, inability to use one side over another as well, because typically under 5, there should be no dominance of a side or a hand. Um, Things like that, where something looks uneven or clumsy or off balance, because those are more refined red flags that parents might not see until maybe a child in sports or in school.
Okay. Now, recently, the Center for Disease Control and Prevention, they updated their milestones on their website, which every family is free to access online. If you just Google the CDC developmental milestones for children, um, historically, and part of my training as a pediatrician, we were taught that a milestone is the age at which at least half children in that age would accomplish that skill. And the updated version of the milestones, and from the CDC website, it now takes into account what 75% of kids at that specific age could accomplish
Yeah.
at a particular age. Would you be able to speak a little bit more about that for us?
Yeah, so when that came out, I have to say a lot of PTs were up in arms, because we truly believe in the early intervention, that you don't want to wait until a child is so delayed to intervene, right? So I think we also have to touch on maybe what is normal, what's a normal range, and when do we need to utilize our resources, financially, with insurance, and our time with these children. So when they updated it to what 75% of the children achieve, that left a big gap. Walking at the time, the old CDC regulations and rules was about a year, 12 months, and now it's changed to 18 months. And that's just an example, but that's a big range. That's a 6-month gap. So I found clinically a lot of children didn't walk at a year. And I internally didn't panic, because so many of my babies were walking around 14, 15 months, um, and doing just fine. When you get to the 18-month mark, I think the problem becomes, also we're also utilizing school services a little earlier with our children. We're doing mommy and me, and other classes at around 2. So if they're not walking by 18 months, that really is a time to intervene. Now, the problem I find is catching those children that aren't going to walk by 18 months, and making that really good judgment call of, we think this is going to be a bigger problem, versus just to say we're waiting at 18 months to make sure we met that time and we're not overreacting. And then you fall a little behind with the school age children, and you'll find issues in the classroom or around peers. For me, I take into account a lot of what the parent says. A lot of our parents go to parks, they go to classes, whether it's music or art. Um, and I listen to them and hear what their concerns are. So if they've noticed for a long time their child hasn't been able to do something, and they're approaching that 16, if they're concerned their child isn't walking, all the other kids are doing it, and that child isn't even pulling to stand at 16 months, I think it's fair to say we should reach out to the pediatrician and get going, because there's a couple of things that need to kind of be there before you take that independent step. But if a child's kind of holding onto the couch, ready to let go, and it's 16, 17 months, I wouldn't panic. Those are just examples. So I think, again, it's really important to have experience with children to know to make these judgment calls, and to really listen to a parent, and to really listen to what's happening in their natural environment, so that we don't abuse services and we don't overutilize services.
Absolutely, absolutely. Specifically when it relates to children with autism or children on the autism spectrum, as uh, my focus in my practice is to help children on the autism spectrum as much as possible. What are the most common physical delays? Because that is one of the comorbidities of children on the autism spectrum that you're finding, or kids who have a known or a suspected diagnosis of autism.
So typically what we see, in the clinic for children with multiple services that are on on that spectrum of diagnosis, they will come in with toe walking, they will come in with discoordination, clumsiness, lack of awareness in the environment, some sensory issues, um, proprioceptive deficits. Some of these children really truly achieve their physical milestones, their developmental milestones on time. So these are the
Hmm.
exact children I was talking about before, where they might achieve all their milestones, but then they get older and we see the quality suffer. You'll see the falling, the discoordination, the toe walking if it's a newer environment. These are the children that you don't want to miss. You don't want to miss helping them to achieve a better quality for safety, for self, for independence. Typically, the parents will come in and um, explain what they have hear about in school, and see maybe when they're at the playground or with friends.
Okay. That's wonderful. Thank you for sharing that. And lastly, how important do you feel it is that parents be involved in a child's physical therapy with physical?
I think the parent is the single most important person in that room other than the child. So the parent is there to guide us with their concerns and to help us navigate this child as a whole child with their other specialists and caretakers on the team, such as a pediatrician, any kind of orthopedic, neurologist, or other specialists. Uh, we get our information from the parent, it's communicated to other specialists by the parent. They're there to report to us what they see when they're at home. We might have the child for a half hour once or twice a week, and the parents with that child 24/7. So quite frankly, what they tell me is so much more important than maybe what I observe in a half hour. I am there to push goals, to note what I observe, and to take all that information and make the right adjustments for each session to get them to their optimal function. But if the parent's not there, I wouldn't have the information fully as I need to make those right judgments as well. So personally, I think it's extremely important that if the parent isn't involved in the direct session, that at the end we give 5 minutes to really catch up and see what's going on. I can't even imagine treating a child without parent involvement. Number one for sure is that parent involvement.
Fantastic. Thank you so much for all that information. It was wonderful to have you join us here today. Everyone, uh, remember to navigate autism with confidence. You can call my office to discuss having a general pediatrician who specializes in autism for a customized, tailored plan for your child navigating the spectrum. And of course, I'm going to give you Jill's information. Her center is called Leaps and Bounds Physical Therapy. We have 3 locations on Staten Island and New Jersey. And Jill, where can they find more information about you and the service that you provide?
So lots of different ways. I would say first go to the internet always, www.leapsandboundspt.net. You'll find all of our contact information, phone numbers to any clinic that's closest to you, our emails. We're happy to help. It shows the services we provide. And we're happy to answer any questions if you call, even if you're not sure if you need the evaluation.
That's fantastic. So everyone, you heard her. Go to the website, check out all the service they provide, and the wonderful staff they have, and the beautiful facilities that they have. Jill, bottom of my heart, thank you so much for being here and serving the community in the wonderful ways that you do. Have a wonderful day.
Oh, thank you for all that you do for our community and for the children. It's really appreciated as as a physical therapist and as a mom of a child that had services. So what you do is so important. We're so grateful. Thank you for having me.
My pleasure. Take care.
You got it.